Osteoarthritis is a degenerative joint disease that often develops silently over many years. It begins when the smooth cartilage that covers the ends of bones gradually breaks down and thins. As the cartilage deteriorates, the joint space narrows and the bones lose their natural cushioning. In advanced stages, the cartilage may wear away completely, allowing the bone surfaces to rub directly against each other. This friction, combined with inflammation and changes in the underlying bone, causes pain, stiffness, swelling, and reduced range of motion. As the joint attempts to repair itself, bony outgrowths called osteophytes, bone spurs, commonly form around the edges, which can further restrict movement. Because these changes occur slowly, many people live with osteoarthritis for years before fully understanding how the condition began in their joints. While osteoarthritis cannot be reversed, early diagnosis and proper management, including physical activity, weight control, and medical treatment, can significantly reduce symptoms and help slow its progression.